In this episode, we're going to talk about evidence-based medicine, applying your clinical judgment, and adding patient values to optimize health outcomes, minimize health risks, and as well, save the healthcare professional time. Let's get started on the 10 steps that I use to apply my clinical knowledge. I'm John Shaske, a clinical pharmacist for the last 40 years, currently clinical instructor at the University of British Columbia. I have won several awards, both provincially and federally, on innovation, and as well an award for Agent of Change from the University of British Columbia. Welcome to Series 2, Episode 1, Applying the Therapeutic Principles to Clinical Judgment and the Patient Values. This will result in optimized health outcomes, minimized health risks, and save the health professional time. Let's take a look at those principles. Number 1, restrict the goals to the patient's goals, not the healthcare professionals. Number 2, I always seek the knowledge of the benefits, harms, and costs of the treatment. Number 3, I honored balanced sources of information. Number 4, I treat according to the level of risk, not the level of risk factors. What does that mean? Is that it might be a side effect that happens 1 in 40,000 times. Am I really worried about that, or am I worried about how often nausea and vomiting will occur? So I think it's important to keep that as a balanced source. Do not bow down to treatment targets such as actual blood pressure numbers. Fasting blood glucose and those sort of things, when you're 90 years old, matter very differently than when you're 40 years of age. Do not pile one treatment upon another. We, over the past few years in the health profession, have added a medication resulting in some side effects. Instead of adjusting maybe that medication or seeing if it's actually necessary, a lot of times we'll use another medication to treat those side effects. And then we add another medication to treat those side effects. And we have to stop that. Number 8, diligently try to find the best possible treatment for care that the individual actually wants for their goals. Start with the lowest dose. Most medications are very effective at very low doses. By increasing the doses, the benefits reduce dramatically. And yet, the side effects increase dramatically. And number 10, if all else fails, consider watchful waiting. Let's talk about an example that I've got with one of my patients. Imagine a lady who is 50 years of age, a former model. She has been diagnosed with diabetes and high blood pressure. She's on 2 medications for her diabetes and 2 medications for her high blood pressure. She's got a busy lifestyle, 2 young teenagers. She is 6 feet tall and 250 pounds. I'm brought in after the doctor talks to the regular pharmacist about this lady and is wondering, gee, I heard about maybe we shouldn't up the dosage of these drugs to get her to target because it's uncontrolled still. Maybe we should add on a 3rd medication, or should we just up the dose? What do you think? The first thing I said was, let's talk to the patient. And she came in. It was really interesting because I said, well, what's the problem? And she says, well, I don't take my medication all the time because when I go to work, I've got to be on. And so I take the water pill, I have to pee. So I don't take it that day because I'm in meetings. And then if I take my diabetic medication, it upsets my stomach and I'm not on. And I've got to do these presentations. She says, I'm just fed up with the whole thing. I simply said, well, what's important to you? And she said, look at me. Look at me right here. And I was looking, and she looked very good actually. But I did notice that there were slight creases on her mouth. I asked her how much she smoked, and she said a pack a day. And she was smoking since she was in her teens as a model, because that's how they kept her weight down. So I took this opportunity to talk to her about looking after her skin. And I explained to her that, number one, what she could do, quit smoking, because that's probably what's causing the lines. But as well, one of the medications that she was on was causing her skin to be more sensitive to the sun. To help her skin better, if she went back to her exercise regime as a model and ate maybe better than she was when she was a model, worked that into her work schedule and her lifestyle, it would help. And we talked about time, and we realized that she's probably spending at least an hour a day just smoking, so just take that time for exercise. We also talk about sun sensitivity, protecting herself, drinking fluids, maybe some creams that she was using. Loved the idea and came up with a plan that worked for her. We got her off the cigarettes. Everything worked out good, and within a year she lost 50 pounds. By losing 50 pounds, she lost 35 points on her blood pressure. That was really interesting because she got rid of that medication. And also because she lost 50 pounds, her blood sugar readings were down enough that the doctor felt comfortable reducing her medications and then taking them off completely. The time, instead of fighting with her to get her to get to targets, was replaced with a quick visit to make sure that everything was normal and within range, and at the same time, she was healthy and she had quit smoking. So her health was optimized, given her lifestyle, minimized her risks, and all the healthcare professionals saved time by spending time in the beginning. Well, everybody, there you have it. The steps that I take to optimize patient outcomes, minimize health risks, and save myself time in the long run. Coming up in the next episode, we're going to take a look at the options that we have for smoking cessation. Don't forget to hit the like button, subscribe button, and if you have any questions, be sure to write them down below and I'll get back to you. Thank you very much for watching, and I look forward to seeing you in the next episode.